Hi, we are Group 19 and we will be presenting on Chapter 10, which cover feeding and eating disorders, elimination disorders, sleep-wake disorders, and disruptive impulsive control and conduct disorders. There are three types of eating disorders: anorexia, bulimia, and binge eating disorder. People who struggle or have these disorders have long-lasting struggles with food and self-image. It is important to note that eating disorders are not the same as short-term dieting or overeating, and it also is important to note that eating disorders disrupt health, emotions, and everyday life. Eating disorders are a consistent battle with food and how someone sees themselves. They're not just about cutting calories or eating too much once in a while. Eating disorders are patterns that negatively affect health and basic daily living. These conditions can weaken the body, create emotional distress, and affect relationships, showing that they're both medical and psychological challenges. The first eating disorder we will cover is anorexia. And anorexia is a constant fear of gaining weight even when someone is already underweight. People restrict food consumption severely, which leads to dangerously low body weight and leads to malnutrition. The cause of it might be because the person might have distorted body image, which makes them believe that they are larger than they truly are, straightening the thought process behind restrictive eating behaviors. People may skip meals, eat extremely small portions, or avoid major food groups. Over time, this leads to a compromise in immune function and dangerous weight loss. The restriction is not occasional but consistent, making it a true life-threatening eating disorder. This misperception creates a vicious cycle that is very hard to break out of. The very mismatch between reality and perception in anorexia is like looking inside a house of mirrors of a fair. Some showing us being short, white, tall, long. For a moment, we believe what's in those funny mirrors since we see them with our very own eyes. And that's enough proof that a person needs to begin this eating disorder. When it comes to anorexia, there are certain effects it has. For example, there are nutritional deficiencies that weaken bones, muscles, hair, and nails. For example, bones may fracture easily because they're not receiving the proper nutrition they need to grow strong and firm. These changes reflect the body's inability to function without adequate nutrients, and they highlight how much damage anorexia causes in the body. Another effect is that vital signs such as heart rate, breathing, and blood pressure decline, increasing risk of fainting or cardiac arrest. Anorexia also tends to damage major organs, including the heart and brain, and raises the risk of organ failure and mortality. When it comes to advanced cases, multiple organ systems fail, making anorexia potentially fatal. Although anorexia can have life-threatening effects, it is possible to treat. One possible treatment is required care for both mind and body, therapy that challenges harmful thoughts and fears, which is one of the most important parts of the recovery process because eating disorders are sustained by distorted beliefs and intense fears. Therapy provides a safe space to explore emotions like anxiety, guilt, or shame that often accompany this disorder. Therapy makes it possible to jump over these barriers and change behaviors in lasting ways. Another treatment is support from others, which strengthens the recovery process. Recovery can be a difficult thing for many people who have anorexia, so that is why it is important that family friends are present and that the person going through this treatment has the correct amount of support, either for family, friends, or even support groups that include people that are also suffering or have this disorder. Next, we have bulimia, which is an eating disorder in which an individual engages in episodes of binge eating during which they rapidly eat an inordinately excessive amount of food. The typical age of onset is often in late adolescence to early adulthood. It is also common that during these episodes, the individual experiences lack of control, which makes them feel like they can't stop eating, which then leads them to purging behavior used to get rid of themselves of excess caloric consumption. And this results in vomiting, taking laxatives, excessive exercise, fasting, and other ways to combat weight gain like purging. Bulimia affects it has been shown that bulimia affects women 5 times more than men, and it happens to men, but surveys show that they go undiagnosed. It is often accompanied by other mental health disorders, and in the US, adults with bulimia, roughly 80.6% had an anxiety disorder, while 70.7% had mood disorders during their lifetime. The physical symptoms of bulimia are dental erosion, bad breath, swelling around the cheeks and jaw, indigestion, frequent constipation, diarrhea, heart related problems, irregular heartbeat, and low blood pressure. There's also binge eating disorder, which is a severe, life threatening, and treatable eating disorder characterized by recurrent episodes of eating large quantities of food. Key characteristics include eating large amount of foods in a specific time periods, for example, within 2 hours, a sense of loss of control during the episode, experiencing shame, distress, or guilt afterwards. A crucial distinction between bulimia and binge eating disorder is that binge eating disorder does not involve regular use of compensatory behaviors, examples like purging or excessive exercise. Some theories of eating disorders include genetics, brain chemistry, perfectionism, control, low self esteem, and the idea of being thin. The media can also affect certain ideas a person might have about weight, and also weight stigma like discrimination or reinforcement fear of gaining weight. To treat eating disorders, we can focus on the brain activity, and there's also cognitive behavioral therapy, which helps patients normalize their eating disorder and manage their thoughts and feelings that perpetuate the disorder. Exposure therapy also represents one intervention that may hold promise for improving eating disorder outcomes. Behavior interventions help reduce the frequency of body checking, and holistic therapy, such as yoga, help with the person becoming comfortable in their body. When it comes to eating disorders, some treatments are also sociocultural perspectives. This area includes a family component for clients with eating disorders who are still in their teens and only had symptoms for a brief time. Family based therapies is more effective in reducing depressive symptoms among teens with bulimia. Elimination disorders are characterized by age inappropriate incontinence and are usually diagnosed in childhood. There are 2 types of elimination disorders: enuresis and encopresis. Enuresis is when a child wets the bed or urinates in their clothing after the age of 5, and encopresis is when a child of at least 4 years old repeatedly has bowel movements in clothing or other inappropriate places. As many as 20 to 25% of 4-year-olds still wet their bed, and about 30% of those that are 3-year-old still soil. By the age of 5, enuresis affects about 5 to 10% of the population. And when it comes to elimination disorders, boys are more likely than girls to experience these conditions. Elimination disorder treatments involve urine alarm, which is a biobehavioral method. It's a device that is attached to the child's underwear or pajamas that emits an auditory sensation in response to moisture. The child then develops a conditioned avoidance response that triggers the muscle contraction and external sphincter of bladder prior to leakage. For encopresis treatment, enhanced toilet training and biofeedback can help gain control over anal sphincters The child is rewarded for continence and taught breathing techniques and muscle training to gain control over the anal sphincter. If they have a retentive form of encopresis, they could benefit from a behavioral training that rewards them for increasing intake of fiber, fluids, and includes time on toilet as part of the daily schedule. We also have sleep-wake disorders. Sleep-wake disorders are a category of disorders characterized by altered sleep and wakefulness patterns. Some example of these include insomnia disorder, narcolepsy, hypersomnolence disorder, breathing sleep-related disorders, circadian rhythm sleep-wake disorders, and parasomnias. Insomnia disorder involves difficulty initiating or maintaining sleep and early morning awakening. Some of the causes include stress or trauma, anxiety, irregular sleep patterns, genetic predisposition, and hyperarousal. Insomnia is not about a few restless nights. It is chronic and the symptoms usually last 3 months or longer and usually happen 3 nights per week. It can affect the daily life with a person feeling low in energy and tired during the day. They might have trouble concentrating. They might have mood changes or mood swings. And their performance at work and school can also be affected because they are not getting the proper rest that their body and brain requires to function at a normal level. On the other hand, we have narcolepsy, which is an uncontrollable need to sleep during the day. It involves sudden episodes of falling asleep, sudden muscle weaknesses, and abnormal CSF or sleep disturbances. Some of the causes include loss of brain chemicals that keep you awake and genetics. It is important to note that it is not caused by poor sleep habits, trauma, or staying up late, but these factors can make the symptoms of narcolepsy worse. Just like insomnia, it can affect the everyday life, in school and work. It can affect the person's social life, and their safety is also affected. Their emotional well-being and energy and motivation are also affected. Then we have hypersomnolence disorder, which is characterized by extreme daytime sleepiness. And even if a person sleeps for long periods of time, which is 9 hours or more, a person might still feel tired. They might have difficulty waking up, and they usually nap a lot throughout the day. Causes can be brain signaling dysfunction, genetics, and neurotransmitter imbalance. Unlike narcolepsy, hypersomnolence disorder, uh, there is no sudden sleep attack, and there is no loss of muscle tone. And usually, to be diagnosed with hypersomnolence disorder, symptoms must be present for 3 months or more. The way to think about these disorders is insomnia is I can't sleep, narcolepsy is I can't stay awake at certain times, and hypersomnolence disorder is no matter how much I sleep, I can't stay awake. We also have breathing sleep related disorders, which are basically conditions in which the breathing patterns are abnormal when a person is asleep. A disorder under this umbrella term is obstructive sleep apnea and hypopnea, which is characterized by sleep disordered breathing where airflow is affected. Apnea is when airflow stops for a few seconds. Hypopnea is when airflow drops, causing oxygen to decrease. And obstructive is when the airway collapses or is blocked physically. Symptoms of this disorder include snoring, gasping, breathing pauses during sleep, daytime sleepiness, and fatigue. And some causes of this disorder are excessive weight, large tonsils, age, smoking, or alcohol use. Another breathing sleep related disorder is central sleep apnea, which involves frequent episodes of apnea when the person stops breathing during sleep, and it involves the brain failing to signal the body to breathe. Symptoms include pauses in breathing during sleep, waking up short of breath, and little to no snoring. Some causes are heart failure, stroke or brain injury, and neurological factors. Unlike obstructive sleep apnea, hypopnea, there is no blockage of airways. This usually just happens because the brain fails to signal the body to breathe when a person is sleeping. We also have sleep-related hypoventilation, which involves episodes of decreased breathing while sleeping, and breathing is faster or deeper than the body requires during sleep-related hypoventilation. Symptoms include restless sleep, sleeping in fragments, shortness of breath during sleep, and some causes are anxiety or panic attacks at night, heart or lung problems, and neurological disorders. Another type of sleep-wake disorder is circadian rhythm sleep-wake disorders, which is characterized by persistent sleep disruptions because of altered circadian rhythm. Our circadian rhythm is an internal biological clock, a clock that helps us match the time inside our body with the time outside the body. It is also characterized by trouble falling asleep or waking, and with fatigue or sleepiness during the day. Some causes include genetics, light exposure, work schedule, altered circadian rhythms, and neurological disorder. In circadian rhythm sleep-wake disorders, the clock, our internal biological clock, does not match the time outside. So it doesn't match the day-night schedule. It doesn't affect the ability to fall asleep or stay awake, but the timing of when to fall asleep is what is affected during circadian rhythm sleep-wake disorders. We also have parasomnias, which are various disorders of sleep characterized by abnormal behavior or physiological activity a person has during sleep. An example of one is non-rapid eye movement sleep arousal disorder, which is basically incomplete awakening from sleep. It involves sleepwalking or sleep terrors. Symptoms include sitting or walking while asleep, screaming and or crying. The person might appear awake but unresponsive, and usually when they wake up or gain consciousness, they have no memory of the events that occurred while they were in this episode. Causes usually are genetic predisposition, sleep deprivation, stress, anxiety, depression, and in some cases, medication. We can think about non-rapid eye movement sleep arousal disorder as a person not being fully awake, but parts of the body can move, react, or behave as if the person is awake. Then we have nightmare disorder, which is frequent dreams a person has when sleeping that are dysphoric, vivid, and distressing. Symptoms include scary or disturbing dreams, waking up fully alert, avoiding sleep because of fear of these dreams, and trouble going back to sleep once waking up. Another parasomnia is rapid eye movement sleep behavior disorder. It involves episodes of arousal during sleep. A person is fully asleep and dreaming, but body acts out as if they are awake. And this is because the brain does not turn off the muscles. Symptoms include talking, yelling, or laughing during sleep, punching, kicking, or jumping out of bed. Some of the causes are age, medications, and neurodegenerative disorders. The criteria to be diagnosed with rapid eye movement sleep behavior disorder involves the symptoms occurring frequently and the person remembering the dream clearly, and usually the symptoms take place during the REM sleep. We have restless leg syndrome, which is an urge to move legs when trying to rest or when inactive because of an uncomfortable or unpleasant sensation in the legs. Symptoms include crawling, tingling, pulling, aching, itching, or burning sensation in legs. Causes can be low iron levels, dopamine imbalance, genetics, or chronic conditions such as diabetes and kidney problems. Disruptive impulse control and conduct disorders are characterized by people who show intense lack of inhibition, also known as disinhibition. Oppositional defiant disorder is most common psychological disorder of childhood with a worldwide prevalence rate of 4.9% of children between the ages of 1 and 7 years old being affected. As we move into adulthood, particularly males are at higher risk of developing antisocial personality disorders, with a small percentage of these males at risk to engage in criminal behavior. Treatments involve therapy as a focal reinforcement, behavioral contracting, modeling, and relaxation training. The goal of treatment is to help children learn how to exhibit appropriate behavior and unlearn problematic behavior. Intermittent explosive disorder is an impulse disorder that makes an individual unable to hold back the urges to express strong, angry feelings and is mostly associated with violent behaviors. It involves outbursts that are either verbal or physical and can be assaultive and or destructive in various ways. To be diagnosed, there are criteria for intermittent explosive disorder. Outbursts must occur at least on 3 separate occasions in the span of a 12-month period. This can include damage to an individual or damage to the property of another individual. Examples include verbal outbursts, temper tantrums, and arguments. An estimated 4 to 7% of people in the US population have this disorder. It is usually caused by faulty cognitions. Treatments involve cognitive behavioral therapy, which its main focus is to reduce anger and aggression while improving the individual's social skills. There's also anger management therapy, which uses relaxation training, cognitive restructuring, and relapse prevention for a 12-week period. We also have conduct disorder, which involves a person or individual violating the rights of others and violating society's norms and or laws. The behaviors exhibited are aggression towards people or animals, destruction of property, deceitfulness or theft, violation of rules either at school, home, or work. Risk factors include trauma, abuse, and neglect, sexual trauma, particularly in females, and GI issues like celiac disease, constipation, diarrhea, lactose intolerance. Around the world, conduct disorder rates are estimated of 0.5 for females and 1.9% for males, with remarkably consistency across the countries. We also have impulse control disorders. This is when individuals engage repeatedly in behaviors that they cannot control and these behaviors may be harmful to themselves or others. In order to gain a sense of pleasure, they feel forced to act on these impulses. Often, these individuals may feel some type of regret after acting on these impulses. The first disorder is pyromania. This is a disorder in which there is a persistent urge to start multiple fires. The diagnosis is established if the person creating such fires is not doing it for financial gain or struggling with any psychiatric or medical conditions. Treatment usually involves CBT, or also known as cognitive behavioral therapy. This disorder is rare but usually more common in men than females, and some signs include an excessive amount of matches or lighters, burnt holes in rugs or fabrics, burnt materials near sink or stoves in their homes. We also have kleptomania, which is a disorder that involves a constant urge to steal. The object is not desired or wished, and it is not seen for its value, but rather is just an urge that overcomes a person. Research suggests that this disorder is similar to substance dependence. In kleptomania, there is an urge before and a satisfaction after stealing. Symptoms include insomnia, agitation, and being irritated. And there is treatment, like cognitive behavioral treatment, and in some cases, medication can be prescribed. This disorder may be aligned with other disorders such as mood, substance use, anxiety, or personality disorders. This has been chapter 10, covering feeding and eating disorders, elimination disorders, sleep-wake disorders, and disruptive impulsive control and conduct disorders. Thank you for your time and your attention.